I'm Barbara Thompson of WLS Center. I want to talk to you today about weight loss surgery the second time around. You know, when we had weight loss surgery, we thought it was the surgery for a lifetime, but more and more we're finding that the effects of the initial surgery are wearing off and people are regaining weight. A lot of people just want to hide away and they think that they're complete failures and that they're the only one that this is happening to. But the American Society for Metabolic and Bariatric Surgery have started taking a look at the phenomenon of second surgeries, and hopefully they're going to be doing some tracking of this. Now, there are several ways to approach second surgeries. Some people have not been happy with the weight that they lost from the initial surgery. They lost either very, very little weight or they didn't even get close to what their goal weight should be. And for those people, they are looking at having what's called a revision, going from one surgery that they initially had to another. For instance, if they initially had a lap band surgery, they may be doing a revision to a gastric bypass surgery. If they had gastric bypass surgery, they might be looking at doing a revision to duodenal switch surgery. Now, there is another type of second surgery, and this is when the patient has lost their weight, but then they started to regain the weight and regained a considerable amount of weight. And hopefully they have tried earnestly dieting and exercising and really following the rules to try to get that weight off. But for some people, it's just not working. And those are the people who maybe want to look at having a second kind of surgery. Now, for those people, there are different procedures that are becoming more and more popular. One is called the StomaFix procedure. In that procedure, an instrument is put down the patient's throat, so there are no incisions, and the instrument goes into the pouch, and the instrument makes little pleats so that the pouch is made smaller. And the pleats are also made in the stoma, which is that opening that goes from the pouch to the small intestines. That is pleated also so that that is made smaller. And the result is that the patient feels fuller faster and has that feeling of satiety like we had just after we had our initial surgery. Another procedure that's done is called a sclerotherapy. In that, it is the surgeon takes a look at the opening that goes from the pouch to the small intestines and uses acid around that opening, and that acid forms scar tissue so that the opening from the pouch to the small intestines is made smaller and smaller. The result is that when you eat, the food stays in your pouch a lot longer, again, so you have more of a feeling of satiety. Another approach that's used is to have a lap band put around the pouch that's made from the gastric bypass surgery, and that lap band cinches the pouch so that it's made smaller. And again, the patient is not able to eat as much food as they were before they had the procedure done. What you do need to understand, though, is that most of these procedures are not covered by insurance unless the patient is morbidly obese. But what is clear is that for many of us who have had weight loss surgery, it's not forever. And if we have really earnestly tried following the rules of dieting and exercise and that's not worked, then you may want to look at another procedure. But the important thing is, don't wait until you have regained so much weight, and it's so much more difficult to deal with then. Don't wait before doing something about it. There are a lot of procedures out there to help you. Well, that's it for today, and I will talk to you again in 2 weeks. Bye, everyone.